but you have a healthy diet? You know, what's your stress level like? You know, what exposure do you have in your environment? You know, there's things that people have more exposure. But we know that our lifestyles, how we live our life, pretty much determines the type of disease I'll be treating in my office later on in your life. This is just the way it is. So it's important to know that, and that's where we come in. I look at RX as a health company. Now, I know it's an opportunity company. And in fact, you know, Cameron we had a discussion. What do you think, Dr. Strand? Do you think RX is an opportunity company or a health company? He said, I got to look at it from a physician's perspective. RX is a health company to me. Now, it's a great opportunity for anybody who wants to do the business, but I trust me. The way they approach developing their products, doing it, it's for health, but I want to give you at least some insight of the business that you're entering into. So, I represent a lot of Nutrify. And Nutrify also is considered first-step therapy. Well, let me define first-step therapy. The medical community, physicians, medical schools, all of that, encourage us as physicians to give our patients an opportunity, a chance, to firmly establish healthy lifestyles at the first diagnosis of many diseases like, you know, maybe early diabetes or high cholesterol, elevated blood pressure. There's osteoporosis. There's a lot of diseases that when we come, we should offer them first-step therapy, which are healthy lifestyles. That's first-step therapy. The next time you see an advertisement for cholesterol-lowering drugs, you know, Crestor, you know, Zocor, Lipitor, any of those, okay, watch them real closely. Listen to them. They say, when diet and exercise have failed, then you go to our drugs. Why is that? Well, the reason is that's how the FDA has approved them as second-step therapy. They're not first-step therapy, but doctors, we as physicians, pretty much give first-step therapy lip service as we write our prescription. Well, and there's a reason, a couple of reasons. One is we don't think our patients will make changes. And even if they do make changes in their lifestyle, they won't be clinically effective because we've been in this low-fat, you know, program for so many years that, you know, and I tell you, even my most zealot patients that went on a strict low-fat diet can only lower their cholesterol about 3 points. But when you start dealing with everything we're talking about and go, it's dramatic. But the point is that doctors just don't think they're going to do it, so I might as well write my prescription to begin with. Well, Nutrify was developed with first-step therapy in mind. And that's something you have to understand, that individuals, whether they have their health, they're in level 5, or maybe they're just starting to see some, oh, my blood pressure's going up a little bit, oh, the doctor told me my cholesterol's up, and, you know, let's give me a chance, or I don't want to take their drugs. This is something that you go on, then I can go ahead and try. But this might be when you see people, or they're coming to you, they're motivated. But the quality of these products is really what's involved with first-step therapy. So we're going to talk about levels of health. So to go from 5 to a 6, you have to become more proactive in protecting your health. That's the basics. Now, you can do, I'll show this, you can do slenderize, you know, and the only thing I would do, I wouldn't backdoor healthy lifestyles. You know, I would say the slenderize makes it easier to go through and to make these changes, but I think we need to be talking healthy diet. I think we need to be talking exercise, and you need to be taking supplementation. I'm a very firm believer, at least in the optimals, you'll see why, with everything else, along with slenderize, and accelerate. So that's what I believe, but I say healthy for life because that's what my program is in my practice. But then if we want to go from level 6 to level 7, there's a concept of detoxification. I'll explain that. But we need to go through some detoxification to go to level 7. They want to go to level 8, then they have to really start paying attention to their environment and cleaning up their environment. And